NLN NEX Reading Test Questions. Question 1. Which statement gives the best main idea of this passage? A paragraph describes a problem, then lists 3 practical ways to solve it in this homeostasis item. Option A. The paragraph is a poem. Option B. The paragraph uses a problem solution structure. Option C. The paragraph avoids solutions. Option D. The paragraph is only chronological. The correct answer is option. It first identifies a problem and then presents solutions. The paragraph is a poem is not supported by the passage, the paragraph avoids solutions is not supported by the passage, and the paragraph is only chronological is not supported by the passage. Question 2. During a quick NEX review of a scientific method item, which statement gives the best main idea of this passage? A medication label says to shake the bottle before measuring the dose. Option A. Shaking helps distribute the medication evenly. Option B. Measuring should happen before reading labels. Option C. Shaking changes the drug into water. Option D. Dose accuracy does not matter. The correct answer is option. Some liquid medications need mixing for an even dose. Measuring should happen before reading labels is not supported by the passage, shaking changes the drug into water is not supported by the passage, and dose accuracy does not matter is not supported by the passage. Question 3. After checking the choices in a control group item, which statement gives the best main idea of this passage? A passage notes that older adults may be at higher fall risk because of vision changes and muscle weakness. Option A. Vision changes prevent injuries. Option B. Age-related changes can increase fall risk. Option C. Older adults never fall. Option D. Muscle weakness improves balance. The correct answer is option. The passage names changes that can make falls more likely. Vision changes prevent injuries is not supported by the passage, older adults never fall is not supported by the passage, and muscle weakness improves balance is not supported by the passage. Question 4. If a sample size stem gives one clear clue, which statement gives the best main idea of this passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A. Timed sets remove all content gaps. Option B. A timed practice can build exam familiarity. Option C. The exam has no time pressure. Option D. Comfort never changes with practice. The correct answer is option. The passage connects timed practice with increased comfort. Timed sets remove all content gaps is not supported by the passage, the exam has no time pressure is not supported by the passage, and comfort never changes with practice is not supported by the passage. Question 5. When time is limited on an enzyme activity question, which statement gives the best main idea of this passage? A chart compares 3 study methods and shows the highest scores for mixed review sessions. Option A. Charts cannot compare outcomes. Option B. Mixed review sessions produced the strongest outcome in the chart. Option C. Mixed review had the lowest score. Option D. All methods had identical results. The correct answer is option. The chart identifies mixed review as the highest scoring method. Charts cannot compare outcomes is not supported by the passage, mixed review had the lowest score is not supported by the passage, and all methods had identical results is not supported by the passage. Question 6. Given the information in a pH scale item, which inference is best supported by the passage? A community clinic added evening hours, and attendance increased among working adults. Option A. Working adults avoided the clinic more often. Option B. Expanded hours improved access for people who could not visit during the day. Option C. Evening visits made all care free. Option D. The clinic stopped serving adults. The correct answer is option. The passage links evening hours with increased attendance among working adults. Working adults avoided the clinic more often is not supported by the passage, evening visits made all carefree is not supported by the passage, and the clinic stopped serving adults is not supported by the passage. Question 7. Suppose a similar solution chemistry item appears on test day, which inference is best supported by the passage? A student reread difficult paragraphs and wrote a 1-sentence summary after each one. Option A. Only long notes improve reading. Option B. Active review can improve understanding of complex text. Option C. Summaries should replace reading. Option D. Skipping hard paragraphs saves time. The correct answer is option. The student uses summarizing to check meaning after reading. Only long notes improve reading, is not supported by the passage. Summaries should replace reading, is not supported by the passage, and skipping hard paragraphs saves time, is not supported by the passage. Question 8. While working through a timed genetics clue set, which inference is best supported by the passage? A hospital placed hand sanitizer near every doorway, and staff use rows during shift changes. Option A. Staff should avoid sanitizer during shifts. Option B. Safety improves only through written rules. Option C. Doorways cause infections by themselves. Option D. Making supplies easy to reach can support safer habits. The correct answer is option. The change made the desired behavior easier and more visible. Staff should avoid sanitizer during shifts, is not supported by the passage. Safety improves only through written rules, is not supported by the passage, and doorways cause infections by themselves, is not supported by the passage. Question 9. Before choosing an answer in a cell division item, which inference is best supported by the passage? A patient education sheet used short sentences, headings, and pictures. Option A. Long paragraphs are best for patient teaching. Option B. Clear formatting helps readers understand health information. Option C. Headings reduce the value of information. Option D. Pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching, is not supported by the passage. Headings reduce the value of information, is not supported by the passage, and pictures make written instructions unnecessary, is not supported by the passage. Question 10. A student sees this bone support idea on a NEX review, which inference is best supported by the passage? A researcher noticed that larger sample sizes produced more stable survey results. Option A. Surveys do not need participants. Option B. More data can make results more reliable. Option C. Large samples remove every error. Option D. Small samples always prove a theory. The correct answer is option. The passage emphasizes stability from larger samples. Surveys do not need participants, is not supported by the passage. Large samples remove every error, is not supported by the passage, and small samples always prove a theory, is not supported by the passage. Question 11. One muscle movement practice problem tests this skill, which inference is best supported by the passage? A nurse calmly repeated discharge instructions and asked the patient to explain them back. Option A. Teach back checks whether the patient understands instructions. Option B. Discharge instructions should be avoided. Option C. Patients should memorize medical terms first. Option D. Repeating words proves the nurse is confused. The correct answer is option. Having the patient explain instructions confirms understanding. Discharge instructions should be avoided, is not supported by the passage. Patients should memorize medical terms first, is not supported by the passage, and repeating words proves the nurse is confused, is not supported by the passage. Question 12. Several choices look tempting in a nerve signal item, which inference is best supported by the passage? A graph showed water intake rising each week after reminders were added to a wellness app. Option A. The app removed the need for habits. Option B. Reminders may have encouraged more consistent water intake. Option C. Water intake decreased every week. Option D. The graph proves reminders cure illness. The correct answer is option. The passage connects reminders with increased intake. The app removed the need for habits, is not supported by the passage. Water intake decreased every week, is not supported by the passage, and the graph proves reminders cure illness, is not supported by the passage. Question 13. For this endocrine message nursing entrance question, which inference is best supported by the passage? A paragraph compares online classes with classroom learning by discussing flexibility, cost, and interaction. Option A. The paragraph tells a fictional story. Option B. The paragraph lists only causes. Option C. The paragraph gives a step-by-step procedure. Option D. The paragraph is organized by comparison and contrast. The correct answer is option. The paragraph examines similarities and differences between two learning formats. The paragraph tells a fictional story, is not supported by the passage. The paragraph lists only causes, is not supported by the passage, and the paragraph gives a step-by-step procedure, is not supported by the passage. Question 14. In a short glucose regulation practice STEM, Which inference is best supported by the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A. Volunteer programs grow without communication. Option B. Former patients stopped the program. Option C. Orientation should never include stories. Option D. Personal stories can motivate people to participate. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Former patients stopped the program is not supported by the passage, and orientation should never include stories is not supported by the passage. Question 15. Among the choices in a chart reading item, which inference is best supported by the passage? A study guide placed key formulas in boxes and practice questions beside each formula. Option A. Formulas should never be practiced. Option B. Boxes make formulas incorrect. Option C. Pairing formulas with practice helps students apply concepts. Option D. Practice questions replace all instruction. The correct answer is option. The guide connects a rule with immediate application. Formulas should never be practiced is not supported by the passage. Boxes make formulas incorrect is not supported by the passage, and practice questions replace all instruction is not supported by the passage. Question 16. Using the facts in a ratio setup question, which inference is best supported by the passage? A patient reports dizziness after standing quickly from a chair. Option A. Dizziness proves a broken bone. Option B. Standing always improves circulation. Option C. Chairs cause infections. Option D. The symptom may be related to a sudden blood pressure change. The correct answer is option. Dizziness on standing is commonly linked to blood pressure shifts. Dizziness proves a broken bone is not supported by the passage. Standing always improves circulation is not supported by the passage, and chairs cause infections is not supported by the passage. Question 17. Based on the clue in a unit conversion item, which inference is best supported by the passage? A passage describes how sleep, nutrition, and review schedules all affect test readiness. Option A. Schedules do not matter. Option B. Nutrition prevents all test mistakes. Option C. Test readiness is influenced by several habits. Option D. Only sleep affects learning. The correct answer is option. The passage presents multiple factors that support readiness. Schedules do not matter is not supported by the passage. Nutrition prevents all test mistakes is not supported by the passage, and only sleep affects learning is not supported by the passage. Question 18. Consider this high-yield percentage item concept, which inference is best supported by the passage. A lab note says the control group received no caffeine while the experimental group received caffeine. Option A. The control group receives the treatment first. Option B. Caffeine is the dependent variable. Option C. The control group provides a comparison for the treatment. Option D. The experimental group is ignored. The correct answer is option. A control group helps show whether caffeine made a difference. The control group receives the treatment first is not supported by the passage. Caffeine is the dependent variable is not supported by the passage, and the experimental group is ignored is not supported by the passage. Question 19. Near the end of a fraction item review session, which inference is best supported by the passage? A school added quiet study rooms, and students reported fewer distractions. Option A. Reducing distractions can improve study conditions. Option B. Quiet rooms increase noise. Option C. Distractions are always helpful. Option D. Students no longer needed to study. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Quiet rooms increase noise is not supported by the passage. Distractions are always helpful is not supported by the passage, and students no longer needed to study is not supported by the passage. Question 20. Across similar mean score nursing entrance questions, which inference is best supported by the passage? A nurse explains that antibiotics treat bacteria but not viral colds. Option A. The key point is that treatments must match the cause of illness. Option B. Viruses and bacteria are identical. Option C. Antibiotics treat every infection. Option D. Colds always require antibiotics. The correct answer is option. The explanation distinguishes bacterial and viral causes. Viruses and bacteria are identical is not supported by the passage. Antibiotics treat every infection is not supported by the passage, and colds always require antibiotics is not supported by the passage. Question 21. Since only one choice fits the probability set clue, which inference is best supported by the passage? A chart shows pulse rates before and after exercise, with higher rates after activity. Option A, charts cannot show change. Option B, a pulse is unrelated to activity. Option C, exercise can increase heart rate. Option D, exercise always lowers pulse. The correct answer is option. The before and after pattern shows increased heart rate after exercise. Charts cannot show change is not supported by the passage. Pulse is unrelated to activity is not supported by the passage, and exercise always lowers pulse is not supported by the passage. Question 22. From the information in a test strategy item, which inference is best supported by the passage? A paragraph begins with a claim, gives two examples, and ends by restating the claim. Option A. The paragraph has no conclusion. Option B. The structure supports the main idea with examples. Option C. The claim is hidden in a footnote. Option D. Examples are unrelated to claims. The correct answer is option. The organization uses evidence to reinforce the point. The paragraph has no conclusion is not supported by the passage, the claim is hidden in a footnote is not supported by the passage, and examples are unrelated to claims is not supported by the passage. Question 23. At a testing desk during a main idea review, which inference is best supported by the passage? A patient skips breakfast before a long class and later has trouble concentrating. Option A. Concentration is unrelated to food. Option B. Nutrition may affect attention and learning. Option C. Skipping breakfast always improves focus. Option D. Classes prevent hunger. The correct answer is option. The passage connects lack of food with difficulty focusing. Concentration is unrelated to food is not supported by the passage. Skipping breakfast always improves focus is not supported by the passage, and classes prevent hunger is not supported by the passage. Question 24. Inside a inference clue science or skills item, which inference is best supported by the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. A training may have improved compliance with hygiene practices. Option B. The refresher removed all risk permanently. Option C. Hand hygiene cannot affect infection. Option D. A training increased infection rates. The correct answer is option. The sequence suggests training supported better hygiene behavior. The refresher removed all risk permanently is not supported by the passage. Hand hygiene cannot affect infection is not supported by the passage, and training increased infection rates is not supported by the passage. Question 25. Through careful reading of a author purpose stem, which inference is best supported by the passage? A tutor tells a student to eliminate choices that contradict the passage before guessing. Option A. Guessing is always better than reading. Option B. All choices are equally likely after reading. Option C. Eliminating impossible choices can improve test accuracy. Option D. Contradictory choices should be selected first. The correct answer is option. The strategy reduces the number of plausible answers. Guessing is always better than reading is not supported by the passage. All choices are equally likely after reading is not supported by the passage, and contradictory choices should be selected first is not supported by the passage.